Hi, everybody, and welcome back to the Empower to Advocate podcast. This is Dana Marie, and I am joined here with Michelle.
Hey.
And we're going to dive right in. And just like last episode, don't worry, you can listen to these out of order if you have not listened to last episode yet. But just like last episode, we're actually going to highlight one of the questions that came up in our March Pay What You Can sessions. We did lots of sessions with new parents and caregivers, people who we were mostly meeting for the first time, and hearing from them what questions they had about special education, what sort of concerns they had, what were the challenges they were facing as they were navigating their own child's special education process. And these folks were at all different sort of places in the process. Some had little kiddos, some had older kiddos and had been navigating special ed for quite some time. And they came with just these parents a myriad of amazing questions. One question that we got multiple times was, where do IEP goals come from? So we reviewed a couple of IEPs on the spot with parents, and a couple of parents paused sort of in different conversations and said, but wait, how did we even get to these goals? Like, who makes these goals? Who decides these goals? Where do they even come from? And it was two, very unique situations. One situation where the student was much younger, was in a private preschool, and the people writing the goals really didn't know them that well. And then the other student, it was clear that the school team knew the student very, very, very well. So really it kind of happens all over the place where parents and caregivers are sort of wondering, like, where do these goals even come from? How did we get here? And how did they end up on my child's IEP? So that's what we want to dive into.
Well, they certainly sometimes do, but certainly never should just come from thin air or from a super general IEP bank without any individualized tweaking. Here's the thing. This happens a lot because liaisons, specialists, special education teachers, they got a lot going on.
Mm-hmm.
All right. If you are a special educator or a therapist, we see you, we hear you. We know you have a lot going on. And we know that you're listening to this because you care and want to do the best that you can to support families and your students. That being said, what we see a lot is first, just super general goals that if we picked up another student in that grade and district school, we would probably see 5 more goals just like it. There is nothing wrong with having a goal bank, right? Because when we're going to talk about this, goals have to be linked somehow to what your child's grade level peers are learning in their grade. Whatever the state's standards are for reading and for math, those are where those academic goals are coming from. And even things like OT and speech are coming from developmental milestones of what students should know at a particular age. Okay. So that is where a lot of specialists and educators are starting with their goals. What are students at this grade level supposed to be able to do? Right. Yeah. I was going to turn it over to you, but like we're looking at that, and then we're looking at what your child is then having challenges with in that area. And how are we going to help them get to where their other grade level peers are so that they're meeting those standards? That's the purpose of a goal.
This is so, can you tell we're fired up about this one? It comes up too often, like Michelle said. It's also super fresh on my mind. I just went to some IEP goal training recently. And so I've been thinking a lot about this topic. But to Michelle's point, while there will be some common threads in goals for students with maybe similar profiles or at similar grade levels and similar districts, whatever, while there may be some common threads, you will know as a parent or caregiver if this goal and these objectives are personalized to what your student, what your child can do. And so the way that we sort of ensure that, or the way that we help parents and caregivers ensure that, is in order to write a goal, we need to know what the student is currently doing in that domain. What are they currently able to do in that domain? So if the domain is writing a paragraph, right? If the domain is adding and subtracting 1-digit numbers, if the domain is, I don't know, 1-letter sound, 1-letter blend, whatever the case may be, before we can write a goal for your child to make progress in that area so that we can monitor, we need to know what they can do first. If we don't know what they can do first, then we're just pulling the goal and the objectives really out of thin air. And so obviously you've listened to us long enough to know what we're going to say next, but there needs to be some data. There needs to be a way of monitoring what the student has done in that area up to that point. It could be student work, right? It could be samples of work. It can be assessments. It can be formative assessments. It can be summative assessments. It can be progress monitoring data. It should be progress monitoring data. It could be teacher observations and data collections in the classroom. It can be specialist data collection and observation. The list goes really on and on and on. It really depends on what the area is of the goal is, but whoever is proposing the goal should be able to point to what the student can already do in this area.
And this is really important, in my opinion, is that we pay attention that it is can do. And in a document where so often we are discussing the things that a student has challenges doing, that this is a place where we can really highlight what a student can do. And every student can do a lot of things. Okay. So looking at what are those state standards? What can students do in this area, in this framework, in this standard? And what is your child currently doing based on data? What can they do? They can read at 100 words per minute. They can sound out and blend CVC words with 85% accuracy in 3 out of 5 opportunities. They can match the letters to their name with light physical prompting with 80% accuracy in 4 out of 5 opportunities. This is all data that has been collected on what your child can do. What I have seen so often, and this is not a jab at ancillary service providers, but where I see the can do turning into a can't do the most often is oftentimes in speech and language can do statements, current performance statements, occupational therapy, because they also, while they work in schools, come from like a therapist lens. So a lot of times the therapist that your child might see in school, they might be from an outside agency that's contracted to come in. These are not necessarily educators, and they might also just be learning how to write these documents themselves. So somebody at the school should be helping them to write can-do statements. But this is where I typically see kind of that like copy and paste from like formal evaluations, or, you know, student has difficulty getting up off the floor independently. There's a way to rewrite that even with a can-do statement. So yes, this is very important, and it should be what your child can do.
And you should read that statement and it should resonate with you. You know, you're not in school all day long or every day with them, but it should resonate with you. And if it doesn't, you can ask the school team about, say, that just doesn't sound like, I don't see that. That doesn't sound like what they can do. That's a question, a follow-up question you can always ask. The other thing that we want to ensure these goals are following is that typically an IEP goal is written for a year, right? So when you look at a goal and the objectives that go along with that goal, neither should you look at it and say, my child's going to be able to do that like in the next 2 weeks, or yeah, that's a great goal over the next 3 to 4 years for them to try to do. It should be not just something that is based in data and standards, but also something that's attainable in the amount of time, approximately 1 year, that we say an IEP goal should be attainable in, right? So that was actually one of the things that got brought up, was a goal that just didn't feel attainable based on what the student could currently do. So also looking at it to make sure, like, yes, is this an appropriate goal, but also is it an appropriate goal for the amount of time that my child will be working on this goal? And oftentimes that means it's going to go into the next grade level, right? If I'm writing goals now in March, end of March, beginning of April, those goals are going to take in theory, that child through their next grade level, almost to the spring again, right? Almost to the end of the school year again, right? So also thinking through that is a big piece. And then this is the one that you've for certainly heard us talk about before. If you've been around even for a short amount of time, you have heard us talk about this one, but there is no reason ever for a goal to just be consistently and continually repeated on an IEP for multiple years. There isn't a reason. We've done episodes, we've done tons of social media posts. We won't get into all the details because we're committed to giving you some short episodes that you can listen to as you head to the pickup line or drop off line or running a quick errand. We don't want to give you super long episodes right now, but know that there really isn't a good reason to just repeat a goal. If a goal hasn't been met in a year and hasn't worked for a year, that means that it needs to be changed. It needs to be rewritten. There could be a million reasons why it hasn't worked. Could be a million reasons, and it needs to be reevaluated, needs to be rewritten, and it needs to be, probably new information has to be collected, new data has to be collected. If you're looking at a goal and you're thinking it looks either the same or similar to one. And we always encourage you, this is an extra step and it is a lot of work. And quite frankly, some parents just have us around to do things just like this because we understand that it is tedious. But we always encourage parents to at least take the last IEP 1 year before and match the goals next to each other just to make sure they're not the same, just to make sure that they're showing a clear progression so that you can see how your child is continuing to progress as they get older, different age level, different grade level, and working on different skills and standards based on their access to the grade level curriculum. So that's a whole, like I said, that's a story that we talk about multiple times. We have episodes about that. We have posts about that. But as we sort of wrap up the conversation about where these goals come from, make sure they're not coming from the previous IEP.
Yeah. And, I'm thinking about a particular situation that we were helping a family out with, and this child had the same objectives for over the course of 4 years. And every once in a while, 1 year, one of them would disappear, but then it would reappear the following year. But the thing that was the oddest about this was that in the progress report, it would say that the child was making progress.
They're always meeting those objectives.
So why are they making progress on this goal, but then needing them for 4 years? So I know that sometimes also, and this is just a side note, progress reports should be sent home every time your child gets a report card. These progress reports will give you information on if your child is progressing on their IEP goals and objectives. Please make sure you're reading those and you're saving those, because then when you get next year's proposed IEP and it's now saying that your child was not progressing, so might need to repeat those goals, you then have the evidence, right? And I hate to use a word like evidence, but you now have the paperwork that says, but you said that they were making progress.
Yeah.
Or if your child is not making progress and that's reflected in those progress reports, a meeting should be called to adjust the goals and objectives to better suit where your child currently is. So IEP goals and objectives are important. They help guide the services and therefore placement that your child is receiving to support them the best in school. So they should not be coming from the previous year's IEP or from thin air.
Never from thin air. So with that, thank you so much as always for listening. If you have other goal questions, we always get a lot of goal questions. If you have other goal questions, send them along. If you need more support in this area, if you need somebody to take a look at goals, definitely reach out to us. We mentioned at the beginning, and we did just want to note, we had many parents and caregivers that we got to connect with through our Pay What You Can sessions in March. There was lots of interest for more sessions this year. And typically our last one is in March, but we are hoping to try to squeeze in one more Pay What You Can session before the end of the school year. So if that is something that you are interested in, keep your eyes and ears here and on our social media pages. Make sure you are subscribed to our newsletter, as you will hear about them first there. But we are hoping to bring those sessions back to you one more time before the end of the school year, which is creeping up on us quickly.
It sure is.
Crazy.
All right, everybody, have a great day.
Thanks so much.